the JAMA Network.
Dr. Stephen Narod, a Canada Research Chair in Breast Cancer. I work at Women's College Research Institute and the Dalla Lana School of Public Health at the University of Toronto. We all wish to diagnose breast cancer when it's stage 1, that is node negative and less than 2 centimeters, and various successful programs of breast cancer awareness and mammography have had a lot of success in doing so. Our goal in this study was to see to whether or not that has been equally effective in women in the United States of various ethnic backgrounds, in particular Black women, white women, Hispanic women, and Asian women. And if there were differences in the proportion of cancers at stage 1, to this have an impact on the survival of breast cancer in that group. We studied 452,000 women with breast cancer diagnosed in the United States throughout the country from 2004 to 2011. We followed these women for up to 7 years, and we recorded whether or not they died of breast cancer, died of another cause, or were still alive. We then divided the women into various subgroups based on their ethnic group. In particular, Black women, white Hispanic women, Asian women, including Japanese, Chinese, and women from South Asia, including India and Pakistan. We then sought whether or not what proportion of these cancers were diagnosed at the optimal stage, which is stage 1, and we asked among those women who had stage 1 cancer, what proportion had died of breast cancer had a 7-year cutoff. We found, for example, the Black women dramatically, for all of the variables we looked at, did relatively poorly compared to the other groups. For example, Black women were less likely to have their cancer diagnosed at the early stages than were white women. And for women who were diagnosed at an early stage, that is less than 2 centimeters, Black women had a much poorer survival than white women. The majority of the women, over 90% of the women with a stage 1 breast cancer actually survived 7 years without recurrence, but the proportion who died was still higher for Black women, approximately 9%, than it was for white women, which was closer to 5%, or for Asian women, which was down around 3%. So among cancers that are diagnosed, considered at an optimal stage, due to either early awareness, physician examination, self-examination, or mammography, there was still a toll from breast cancer, and that toll seemed to be disproportionately felt among women of a Black race. The outcome of early-stage breast cancer differs by racial background of the women. It doesn't seem to be due entirely, or in a large part, didn't seem to be due to access to care or awareness. It seemed largely to be due to an intrinsic or biological propensity of small breast cancers to spread. A woman with a 2 centimeter breast cancer who is Black was more likely to present with a node positive breast cancer or a metastatic breast cancer than a white woman with a similar breast cancer of 2 centimeters. So it did seem that intrinsic biological aggressiveness was part of the difference. There could be other factors as well which lead to that or which contribute to the difference. It's, of course, our goal to eliminate the disparity, the difference in the outcome based on race. So I think it would be very important in the future, if large studies are done, to use racial background as one of the factors which predicts survival, and to take consideration of racial background when we're comparing different groups of women. One thing we would like to explore ourselves is whether the patterns of breast cancer recurrence and mortality in Black women in the United States are similar to the patterns in African women or Black women in other countries, for example, the Caribbean. By comparing women of a similar ethnic group, but living in different environments for outcome, we may get a clue as to what's driving these differences. Is it the intrinsic genetics, or is it the environment and the lifestyle to which they're exposed?